Hello everybody, my name is Peter Dorn, this is Spencer Smith, and we're from Pareto Health, and today we're going to talk about the topic of lasers on a self-funded plan.
Subjects, which usually scares people, but sometimes they'll make them laugh too. We're going to talk about lasers. So Pete, I've got an illustration here that'll cover what lasers are, but why don't you sort of describe for the audience what it means to be lasered or have a laser?
The term laser. So reinsurers, stop-loss carriers are great at pricing out unknown risk. Okay, they use their actuarial tables, use the law of large numbers to predict that risk. Remember, they're looking at they're looking at demographics, self-funded experience, industry codes, things of that nature that come up with that stop-loss premium. Okay, once a claimant though becomes known during the course of the policy year. Okay, let's say as an employer, you're my employee, and unfortunately you get cancer in the middle of the year. Okay, that risk now goes from becoming known. From unknown to known.
Yep.
Okay, reinsurer sees that. So at renewal, they're going to set a higher deductible for your cancer. So the group in your prior example might have an individual specific deductible of $100,000, but because of your cancer now, you might have a deductible of, let's say, $300,000 or $400,000. Okay, this creates volatility because now the employer has to fund the first $300,000 or $400,000 specifically for you and your condition, right? Rather than pay that normal $100,000. This is called a laser.
So a laser. So let's kind of specify it. It's a higher deductible for an individual, or sometimes more than one individual, right? They're usually named by the stop-loss carrier. I've got Tom Smith, my infamous Tom Smith that I always use in these examples. Tom Smith has a laser. He's been named by the stop-loss carrier. That stop-loss carrier has placed a laser on him for the year. But you said everybody else still has that same deductible unless they've been specified by the carrier, correct?
That's correct.
Okay, so my claimant number 3, he's going over the 100K ISL, or she is, and so that's being reimbursed like it normally would. But what happens when Tom Smith has a $225,000 claim, but he has a $200,000 laser? What are the mechanics?
This just means that the reinsurance carrier will not start reimbursement on that individual for Tom Smith until that limitation goes over $200,000.
Okay.
Okay, so the deductible increases specifically for Tom Smith, and in many cases specific to his diagnosis, right, of cancer. And so the reimbursement contract doesn't start until the limitation exceeds that $200,000.
So the employer then funds every dollar up to his lasered amount, right?
That's correct, and this is the volatility that I'm talking about. Lasers are not great for a self-funded plan because it adds liability to the plan overall.
Yeah, so basically what's happening is the stop-loss carrier is, you said it went from unknown risk to known risk. Usually this happens, right, because these claims, their duration is lasting longer, right? They're not just wrapping up in one policy. They're trending over to the next year, right? And the carrier's saying, well, I can predict this person with relative accuracy, so I need that laser, right? I need to push some of that risk back to my employer, so that now you are taking that, Mr. and Mrs. Employer, and I have enough premium to manage all these other unpredictable things that I am unaware are going to happen. Correct?
Right. The basic premise is that the stop-loss carrier needs to get enough premium to cover that risk, or they need to carve that risk out with a higher deductible.
With higher deductible.
That's correct.
So what do we do though? So let's talk about that. Sometimes lasers are placed on the inception of a policy, the start of the policy. Obviously, we'll get into no new lasers at renewal in a moment and how you can prevent that from happening in the future. But if I am an employer, or I am a consultant that has an employer that a laser has been applied to this policy, what are some things I need to think about? What are some things that I need to do to either explain it or counteract that laser being applied?
Yeah, I mean, I think in the industry, laser often gets a negative connotation.
Yep.
Okay, there are some examples in which lasers actually benefit the plan. Okay, and this is the morbid side of our business. Okay, let's say somebody has a diagnosis that, or a treatment plan that foresees them not making it far into the next policy year. Okay, maybe they're going to be deceased. Okay, because of what ails them. Okay, in that case, in that scenario, a laser might make perfect sense. Right, because rather than taking that premium increase and spreading that amongst all your employees, right, that laser is essentially only affecting that one individual and not having that systemic increase to your plan cost.
Yeah, so yes, you could have put it all into your premium, like you said, right? Usually you're going to get overcharged for that, right? They're going to be more premium than the laser would have had to have been. Now you set your baseline at a higher number for next year's renewal just because you didn't want to have a laser. But exactly in that example, somebody unfortunately could pass away. Somebody could, better news, could just leave the plan, get a new job, go on their spouse's plan, recover.
But in most cases, that claim is going to stay on the plan. And I think that presents an opportunity for self-funded employers. Okay, what can we do what type of vendorship can we employ to help manage that specific claimant, right? If it's drug related, can we look at alternatives to those specific drugs, or can we get those drugs cheaper than the current setup, right? If it's a medical claim, right? What can we employ? What resources can we employ to help the employee actually manage the claim, or give them the resources, the doctors, the specialists, in order to help them negotiate that claim down and get that claim lower? So I think it presents an opportunity.
I think you're right? Because now, one, we've got our data, we're self-funded. We've got a TPA that's going to help us manage these things. We might have disease management programs, cost management programs. We've identified a problem. Now let's go address that specific problem, try to control or wrangle in those costs. I've heard, and I was going to ask you, roughly speaking, what percentage of lasers actually apply? I mean, that number I know can vary depending on who you ask, right? But what's the number you've heard?
If you poll most stop-loss carriers, it's actually a surprisingly low number. Less than actually probably 35% of those lasers actually come to fruition. And I also want to point out too, again, when I talk about the differences between self-funded and fully insured, think about if you get that same claimant and you're fully insured, there is absolutely no opportunity to actually manage that claim whatsoever or to carve that risk out. Okay, you are simply taking that network discount, putting that on top of the claim, and that fully insured carrier will pay that claim.
Yeah, it's not like just because you're self-funded, you have this risk on your plan. That risk would have existed on the fully insured plan as well. You're absolutely going to be paying for it year after year with renewals too.
Correct.
So anything you want to add on lasers before we move into one of my favorite subjects, ag specs? Anything else we need to talk about around lasers? Maybe we talk about the no new laser provision, things like that.
Sure, I just want to add with the volatility in the market, what we mentioned before, that it's perfectly acceptable or actually commonplace now that we see groups with lasers going into a self-funded plan. Okay. Whereas before, maybe 5 years ago, you'd have a laser every now and then. Now we see, I would say, I don't know the exact numbers on this, but I would say probably half of the groups that enter a self-funded arena see some type of limitation on claimants, see some type of laser on their plan.
Yeah, and I think the point is the industry used to react and just say, almost like, no lasers. I don't want it. I can't handle it. I'm never going to consider this. Now I think the industry is certainly softened. Employers have come around to how you can actually use that to your advantage, or at least neutralize some of the disadvantage. And so it is becoming more commonplace. And so you have to have a long-term plan of how to counteract those. So what is the long-term plan provision that typically helps us in that situation over the long haul?
Yeah, I think it's what you mentioned before. Okay, employers having their mentality is, I'm going to buy insurance over the next 12 months. Okay, when we are self-funded and we can chart a course, over the next 4 or 5 years and potentially longer, okay, we can employ some of these vendorships that are at our disposal. Okay, we can adjust the stop-loss policy, to coincide with the amount of risk we want to take as a self-funded employer. There are things that we can do when we project the claims out, when we have the data, when we understand how far out those claims are going to occur, or more importantly, when they're going to come off the plan. Okay, so we can appropriately adjust the plan and make adjustments along the way that benefits the employer.
Awesome. Well, so let's move on to